being with us, and very happy to hear you and see you.
Thank you, Doctor. Thank you, Dr.
I am from St. John's previously, retired from St. John's.
Oh, okay. That's great. Yeah, we have quite a few good friends from St. John's. Dr. Fernandez in UK.
Yes. James was with us, and then he came to Bangalore. He comes, even still he comes. We have some combined programs with him on pediatric orthopedics.
That's fantastic.
Yeah. Okay. Kishore, by chance, you attended the Guntur OSAPCon sometime over 10 years back?
Yes,
I think
absolutely. Yeah.
Yes.
Yes.
But I remember having met you, but I cannot place where I met you.
Yes, I attended that conference. Yes.
Yeah. Yes, Rujuta.
So, welcome everybody on behalf of the Wadia Children's Hospital. This is the last of the trilogy with IOA supporting it as a part of the JBJS Robert Bucholz Journal Club grant. And we thought we would have a nice array of different speakers this time. Something that is not covered in the PG program, and it is of great value if you want to see and leverage how to move forward with the orthopedic knowledge that we have. So I request Dr. Shivashankar, our IOA President, to please inaugurate the program, and followed by words of welcome from Dr. Rajagopalan.
Good evening, everybody. Good morning, Dr. Kishore, Mulpuri, and Emily. At the outset, I would like to welcome all of you, especially Dr. Kishore Mulpuri, the President of the Canadian Orthopaedic Association, and Dr. Emily, Research Director at Pediatric Orthopedics, British Canada Children's Hospital, Vancouver. I must once again congratulate the Wadia Children's Hospital for having won this JBJS Dr. Robert Bucholz Journal Club grant, and through IOA we were able to conduct 3 webinars, and this is the last one of them. I congratulate, and also I would like to thank Dr. Rujuta and Alaric for association they had with the Indian Orthopaedic Association. I would like to thank Dr. Rajagopalan also for getting the Indian PG training subcommittee involved with this activity. I am sure this is going to help a lot of young generation orthopedic surgeons in writing a paper, how to get a grant, all the details which we have been listening in the last 2 webinars and today's webinar. With these few words, I declare this scientific webinar open for scientific deliberation. Thank you very much.
Thank you, President. On behalf of the Indian Orthopaedic Association and also the PG Training Committee, I extend our welcome to the eminent faculty, Dr. Kishore and Dr. Emily. And this particular program, we have been looking forward to it for the last month. We heard about it. As all of you will know, there's a field in which many of us need some direction, some guidance, and probably some advice. So we are really looking forward for the 2 talks. So I won't take more time from you, but it has been a great pleasure to have the President of the Canadian Orthopaedic Association joining our program. Thank you so much. Over to you.
I would now request Dr. Alaric Aroojis to please introduce Emily.
Yeah, thanks everyone. And it's really a great honor and pleasure to welcome 2 of my really good friends to this webinar. And I can think of no 2 better people to talk about something which is a little alien to us in India. You know, we have so much of clinical work going on here. We have a large spectrum and a wide spectrum of cases, but for some reason, throughout our residency and even later on, there hasn't been much emphasis on research methodology. There hasn't been much emphasis on global collaboration. There haven't been much emphasis on how to get together with different other colleagues from around the world to improve research into what we are doing. And I thought, therefore, that this topic is very, very suitable for the IOA series, because we have young surgeons, and I'm hoping that we can stimulate some of these young minds at least to get into the importance of research methodology, to understand how to write up research grants, to understand the power of global collaboration. And I'm so happy to introduce our first speaker today, who's Emily Schaeffer. She is, I would say without doubt, Kishore's right hand. She has been single-handedly managing the entire research institute back at the BC Children's Hospital, Vancouver. And over the years, I've known her first as a colleague and then as a really good friend. And we have developed some great friendships over the last 5 or 6 years, which have known each other. Emily is the research director at the BC Children's Hospital. And she's also the scientific lead of some very important global registries, including the International Hip Dysplasia Registry, the SLIP Registry, and more recently, a global consortium of various people and experts from around the world, which is called the Hip Hope Network. Emily joined the Department of Pediatric Orthopedics at BCCH in September 2014, and she has an extensive background in basic science and translational research. She holds a PhD in experimental and molecular medicine from Dartmouth College, and she has worked really closely with Kishore to develop and expand the pediatric hip research program, much of her work focusing on the creation and expansion of the IHDR, the SCSE Longitudinal International Prospective Registry called the SLIP Registry, and as I mentioned, the Hip Hope Network, which is the hip health outcomes in pediatrics. As a research director for the orthopedic department, she supports the department in the research program by offering high-level scientific advice and expertise on various study ideas and methodology, and provides feedback on grant applications, manuscripts, and protocols. So she's really an expert in many of these fields, and I'm really grateful to her for accepting this invitation to guide many of us in how to develop the scientific mind and the research methodology that is really lacking in India. Thanks to the efforts of Emily and her team, the IHDR and the SLIP registries have grown to include hospitals and academic centers from 30 hospitals across 5 continents. And at the last count, I think we have recruited over 4,000 children in the IHDR, which is really an enormous contribution to the development of research into children's hip health. So we're really excited to listen to Emily today, and thank you so much, Emily, for joining us. I'll pass it over to Rujuta to introduce our second speaker, that's Kishore, and she has really the honor of introducing the current president of the Canadian Orthopaedic Association, another extremely good friend of us in India.
So, as rightly said, total pleasure to introduce Kishore, who is not only a mover and shaker, but also a go-getter for a lot of things, and very proud because he's a son of the Indian soil. And he's the head and professor of Department of Orthopedics at the University of British Columbia, as well as a pediatric orthopedic surgeon at BC Children's Hospital. He completed his medical and orthopedic training at Kasturba Medical College in Manipal, prior to pursuing fellowships at Women and Children's Hospital, Adelaide, Australia, and working with the Royal Children's Hospital in Melbourne. He also completed a clinical research fellowship in orthopedics at BC Children's Hospital. Dr. Mulpuri's clinical practice and research interests focus on pediatric hip and cerebral palsy. He regularly treats patients with a wide range of conditions, including developmental dysplasia of the hip, cerebral palsy, Legg-Calvé-Perthes disease, and osteogenesis imperfecta, slip capital femoral epiphysis, and trauma. Dr. Mulpuri also founded the Hip Health Outcomes in Pediatrics, that is the Hip Hope Network, a growing global network of hip health professionals whose aim is to reduce the burden of all hip conditions through clinical care, research, education, and training. Dr. Mulpuri is also regularly involved with the development of new clinical practice guidelines. Most recently, he chaired the work group that developed the guidelines for non-operative treatment and for management of DDH. Dr. Mulpuri takes on several roles, some of which are President of the Canadian Orthopaedic Association, the Research Director, IHDI, that is the International Hip Dysplasia Institute, the Medical Lead at Child Health BC Hip Surveillance Program for Children with Cerebral Palsy, and the co-lead for BC Children's Hospital Research Institute Evidence to Innovation theme, the founding president, the Canadian Pediatric Orthopedic Group, that is the CPOG, the fellowship director, Department of Orthopedic Surgery, BC Children's Hospital, chairman, Medical Advisory Board, HIP Society, and lead in the HIPPY research team at the BC Children's Hospital, and the principal investigator and co-investigator at various international multi-center research studies like the IHDI, SCFE, and Longitudinal Perspective Registry, and the Pediatric Orthopedic Registry of Trauma and Health Outcomes, CP-HIP outcomes. And some of the work which Alaric already mentioned. Dr. Mulpuri also mentors PhD, masters, and cooperative students on a regular basis. And if I may add, he's really someone who has taught us how to really change the way you look at your own work and how to project it to the world. So I think he's really helped us create a paradigm shift. And we hope that, Kishore, all your efforts are going to bear fruit, because I think this talk is going to really inspire a lot of young PGs, and this will take the international collaborations from strength to strength. So without much ado, I think everybody's waiting for the real succinct presentations from both Emily and Kishore. Over to our eminent speakers, and I'm sure everybody has lots to gain.
Great. Thank you, Al. Thank you, Rujuta. Thank you, Dr. Shivashankar, Rajagopalan, and IOA for giving this opportunity. And all I want to say is I wish I'd asked my mom to join rounds today so she could have heard this amazing introduction and kind words that all of you have said. As Rujuta rightly said, not only son of the soil, but after living in Canada for about 18 years, I'm still Indian citizen, so I'm proud to be one. So son of the soil, and I'm still a member of IOA. I'm still a member of POSI, son of the soil, and those will always be my home organizations that I'll fondly remember. My first meeting that I attended in 1994, IOA meeting, and the 1999 POSI meeting, and I'll never forget. So those will always remain. And I was there when POSI was formed and its first official meeting that happened in Manipal. And I'm so proud how far POSI and IOA have come. And I've also been part of initiating the first IOA COA combined symposium in Victoria. And we had another one in Calcutta, but unfortunately, due to pandemic canceled meetings, we haven't had, but looking forward to continuing that collaboration. So this is a really interesting topic. And those of you that are probably thinking how to write a compelling research grant proposal and how to conduct prospective studies, if those young surgeons that are out there, if you're thinking that I was born to be a researcher and doing this, I was born to be a mechanical engineer. I grew up in my dad's workshop. That's what I was going to be. Like most Indian doctors here that can identify, a lot of you might have passionate stories. You knew you were 15 and you had a calling, you wanted to be a doctor. I was forced to be a doctor by my dad because both my brothers are engineers. And he paid donation for me to go to Manipal. And I was just having fun in medical school. Then I got into orthopedic training. I was going to become sports orthopedic surgeon and take care of Indian cricket team. So that was my dream. I went to Australia to do a private sports orthopedic fellowship, and then gradually drawn to pediatric orthopedics, and then, always got interested in research and got on a different path. So what I'm thinking now and what I do now is very different from if you asked me when I finished my PG at 27 years of age. So very different. But I think you got to go where life takes you. And I have a lot of fun doing what I do. It gets me connected with a lot of different people around the world, including my two good friends, Al and Rujuta, who've just been an amazing support. Whenever people write history of pediatric orthopedics in India, and I can tell you these two will feature very prominently for their not only great enthusiasm to make a change, but their ability to bring as many people as you can think of into a room and get them engaged. So, which is not an easy skill that people have. And Emily is going to do most of the talking, and then we will have lots of time for discussion. And so with no further ado, I'll get my I'd call partner in crime, great colleague. A lot of work that we have done has actually happened over the last 6 years since Emily started with us in 2014. So we're really fortunate that Emily stayed on with us and now currently our research director. So without further ado, over to you, Emily.
Thank you, Kishore. And thank you very much, Al, for your very kind introduction. I'm very happy to say that you've become a great friend over the years, and you're an inspiring person to look up to with your tireless energy and to get involved and pushing forward everything over in India and really become such a huge part of our collaborative team over here. And so yes, today, the first part of Kishore and I's presentation, as he's mentioned, we're going to try to keep both parts relatively short in terms of the speaking. And then these topics both lend themselves very well to sort of open discussion and questions. Okay, there we go. So scientific written communication, so talking first about research and grant proposals, but scientific and written communication comes in many different forms. And each has its really own unique features and set of challenges. And research grant proposals are certainly no exception to that. They can be daunting to tackle, particularly when you're sort of new to writing them. And with many different requirements to fulfill in order to really go from your initial idea to the end point of a successful grant. The process really does boil down to a few very critical components. The first and foremost being to ask the right question in order to ensure you're taking the right steps and to answer that question throughout. Throughout the writing process, you really want to actively solicit feedback from any mentors, peers within the field, and always consider the audience, the granting audience that you're writing to, and potentially solicit feedback from maybe people outside of the field, depending on who the granting agency is. One of the first steps is sort of figuring out where your question or where the study you want to perform falls in the research cycle, as that can dictate a lot of your study design and how you properly form your question. Are you looking at an effectiveness of a certain intervention? Are you trying to assess the cost effectiveness of that intervention? Are you looking for the burden of the disease or reassessing what the burden of the disease might be after applying an intervention? So determining the role of the study is going to be really important for shaping your research proposal. To determine the study type that your grant proposal might fall under, you want to consider a few key things. One being to consider what is already known in the field. Is your question or your research proposal at its heart really trying to improve this upon the strength of existing evidence? So maybe there's been previous studies, for example, that have been limited by a certain set of factors, and you're looking to perform a study that improves on that evidence. Or maybe you're looking to generate brand new evidence and fill a gap in the knowledge that previously wasn't there. There have been no prior studies on a certain thing that you're asking. And you want to keep top of mind throughout what the study can really contribute to the field. What does it bring that's different than all of the other previous grant proposals and studies that have come before it? And as I mentioned, the research question is really the foundation of all, not just grant proposals or studies, but it's the foundation of all clinical research. The question will dictate the research design. And questions can range from being hypothesis generating questions. So much like some of the registry work that Kishore and I will both touch on later and discuss, they're largely hypothesis generating, where we're looking to have new questions come up that we want to try to answer specifically by this work. They could also be hypothesis testing questions, which get more at specific targeted trials, such as randomized control trials that you may use to answer a hypothesis testing question. Or they may be somewhere on you're trying to estimate the size and effect or estimate a particular parameter. And so the next question to ask is what study design will best answer that question? there's a very large number of different study designs, and a clear and very operational research question will help to clarify what design that you want to pick. There's, from clinical trials, you have observational or experimental trials, and with a number of different cross-sectional studies, case control studies, cohort studies coming out of the observational side. And within the focus on a clinical trial, which is the focus of many different grant proposals, there are different types of even clinical trials to consider, or randomized control trials. There are superiority trials, equivalence trials, and non-inferiority trials. And particularly in orthopedics and in pediatric orthopedics especially, there is a lack of sort of delineation in these styles of trials. And a lot of questions that we may want to ask in this field are really quite suitable to non-inferiority trials, where you're actually asking, is an alternative treatment no worse than an existing treatment that comes with a secondary set of benefits to it? Maybe it's less costly, or maybe there are less side effects, or it's easier for the families to keep up with the protocols, that kind of thing. Another key component that I touched on was the grant audience. You really need to pay attention to who the grant call is coming from. Is it coming from within your own department or your own institution? So is it an internal grant? Is it coming from a medical society, for example, POSI or POSNA or the Indian Orthopaedic Association? Is it a larger governmental body that's calling for these grants? So for example, in the US, there's the NIH, the National Institutes of Health. And in Canada, the likewise comparative to that is CIHR, the Canadian Institutes for Health Research. Another common grant call can come from, say, a charitable foundation. So each of these different areas where a call can come from will really shape the tone and the direction you take in your grant, and how you explain your research question and therefore the study methodology. Part and parcel to where the grant call is coming from, you want to understand who is on your specific grant review panel. Are they primarily or entirely scientists or medical professionals that are reviewing your grant? A lot of the governmental grants will have research ethicists involved in terms of looking at your study methodology and how you intend to interact with patients. There may be members of the public on the grant panel, and then your lay term summary. So how would you describe it to non-scientists becomes very important. You may also have foundation representatives that are on the grant review panel. And so you must keep all of these in mind when you're going through and shaping the language in your grant. Some key considerations that grant reviewers are looking for. First and foremost is the potential impact that your study might have. You really want to sell the impact portion or the significance portion of your grant that you'll have to write. You don't necessarily have a lot of space to do this in any given grant proposal, but it's something to really flesh out and focus on as a key. Part and parcel with that is the generalizability of your study. Is it internally valid? Is there truth in the study that can then be generalized externally to being, is it true in real life? And as throughout the grant, you really want to take a logical approach with a clear and methodical layout. You want to make it very easy for the grant reviewers to follow your train of thought and your study design and order of events in your study. Some other key considerations, this isn't obviously always possible, but some things that can really strengthen a grant application are to execute a pilot project prior to submission. This pilot project data can help strengthen your rationale that goes into your grant. It can help you work out, the best way to approach a particular problem. Maybe you go down a certain road with this pilot project and realize that you could approach this a different way that would be more effective or more efficient. Another key thing, especially before larger grants, is to demonstrate that you have a proven track record of good collaboration before a larger group grant. A great example of that for us was the POSNA registry grant that successfully got our International Hip Dysplasia Registry that was mentioned in the introductions, IHDR, off the ground. We were the awardees of the first POSNA registry grant for this project back in early 2017. But this was really on the back of a previous 4 or 5 years of work within the International Hip Dysplasia Institute, where we were collaborating with 8 different centers, or 8 to 9 different centers on that project on a smaller scale, and already had those collaborators on board. A big thing too was we had reached out to Dr. Aroojis and Dr. Mehta and other centers around India who were on board and supportive of this proposal and ready to join the International Hip Dysplasia Registry when it got off the ground. And finally, you really want to consider, even at the grant stage, what your knowledge translation efforts will be for the grant. At the end of your getting your findings, how are you going to relay those findings and communicate those findings, both to the medical field as well as the public, providers, patients, and families? We traditionally think of a grant proposal. It focuses very well on these first 3 steps of developing your research question, planning and designing your study, and collecting and analyzing the data. What can get overlooked sometimes, especially in an early grant proposal, is how you're going to tailor those analyses and tell others about your results. It's only by doing this part effectively that you can bring about a change in practice and then reevaluate what that change in practice brought about, what those outcomes are now, in order to sustain this knowledge. And so some examples of that we really tried to focus on lately to really enact change with some of the work we have is we've now formed what we're calling the IHDR Knowledge Translation Advisory Board, or the KT Advisory Board, to help inform our knowledge translation efforts to patients, families, and the public throughout our work. To do this, we've brought together 7 different advocacy groups for developmental dysplasia of the hip, including IHDR, Healthy Hips Australia, Miles for Hips, the STEPS Charity, and DDH UK, as well as our own local here in Vancouver foundation, I'm a Hippie. And we conducted an online survey with the collaboration of these groups to do a global assessment of patient and family experiences across hip dysplasia diagnosis and treatment. And we got overwhelming responses on this survey, and the number of people from around the world that were wanting to respond and share their stories. And to continue knowledge translation efforts, it really is an ongoing thing. It requires sort of continually reaching out and having events. And we held the inaugural International Hip Health Day, where we brought together researchers, medical professionals, patient advocacy groups from around the world to celebrate all of the work that all these different groups are doing, and plan to do more of these in the future. And finally, just want to leave with, for this portion of the talk, the success of your next grant really depends on the success of your current grant. So it's critical to only apply for the current grant if you're ready to execute the study, to really set yourself up for future success. And the grant cycle can definitely feel like a bit of a vicious cycle sometimes. It's supposed to work in this nice, neat, linear order, but in reality, there is a lot of stuff in the background that sometimes you're doing the study first, and then you're circling back to write the grant to get the money to pay for that, sort of retroactively. But the process can be a rewarding one. I'm also happy to, Kishore and I are more than happy if any of you are sort of writing a grant, we're more than happy to take a look and give our thoughts on it from an outsider's perspective before you submit. We're absolutely happy to do that, and feel free to contact me with any questions about it. Okay. And to move to the next section of our talk, as I mentioned, I'll talk through this part, and then Kishore will lead discussion on this, as well as the research grant proposal. So quite coming out of what I was speaking about in the research grant proposal is how to participate in international collaborations and registries. And that's been a huge focus of our work over the last 6-7 years, is really bringing international or global relevance to the work that we're doing. It's becoming so important to understand. And so at BC Children's Hospital, we've really put a focus on setting up some global orthopedic registries. We have a number of different hip condition registries, as well as our counterparts with Dr. Anthony Cooper, looking on the limb deformity side of things with some limb deformity registries. So we currently have the International Hip Dysplasia Registry up and running, the SLIP registry up and running as well for SCIFI. We also are establishing a rare conditions registry, so a rare hip conditions registry under the auspices of the Hip Hope Network, as well as a global Ped Ortho, which is the trauma registry. And we're looking to set up a cerebral palsy registry as well. And then the Cooper team has a number of different registries and studies they're looking to set up on the limb deformity side. And this work was really driven by when we started looking at, the world population distribution. Is we just take up this tiny little bit that you can barely see us over here in Canada. And even in the United States, there's still a relatively smaller proportion of the world population than, say, what's representative in India and China and Asia as a whole. And it's really then, it's of utmost importance for all of us. And we have so much to learn from really embracing collaborations in India, in China, in Africa, across the world, to really increase the relevance of the research that we're doing to the more of the world's population. And with that in mind, that was why the International Hip Dysplasia Registry was born. It's the first registry of its kind in both size and scope in terms of prospective multi-center observational registries for GDH. And the goal is really to optimize patient care of children with PDH around the world, and not just in our own backyard in Vancouver or in North America, but around truly globally. And to that end, we're very excited to say that we're now at 4,120 patients enrolled after 5 extremely hard years of work from all of our collaborators. We have 27 participating sites with multiple more that are onboarding in the process right now that are representative of 7 countries across 5 different continents. So it's an exciting time, and we've had some fantastic collaborators in India on this project that have been wonderful contributors to the study to date. And what IHDR allowed us to do was to dream big with our initiatives. We used it as a model for a number of our global research initiatives, including the development of the SLIP registry, the Ped Ortho or Pediatric Orthopedic Registry of Trauma and Health Outcomes I mentioned, as well as the Hip Hope Network that has now been inaugurated and is getting kicked off to start things. So the SLIP registry, likewise to IHDR, it's younger than IHDR, and the patient population it's less of a frequent condition, but we are at 277 patients enrolled in the SLIP registry so far, with 49 centers either interested, onboarding, or recruiting across 12 countries and 6 continents. And Global Ped Ortho, as I alluded to, it's in the inaugural phase, but a prospective observational registry on pediatric orthopedic trauma and health outcomes. We aim for this to be the largest pediatric trauma registry in the world, and specifically looking at a number of fracture types that have a particular treatment controversy or some clinical equipoise in either taking a surgical or non-surgical approach, or 2 or 3 different surgical approaches, and there's not a clear agreement across the field on what direction to take to treat. And we're seeking global representation for that. We have 20 centers on board already, and we'll be looking to expand that as we grow as well. And finally, in terms of registries and global collaboration, the Hip Hope Network, or Hip Health Outcomes in Pediatrics, really represents the pinnacle of all of our efforts for this. It's beyond research, the scope of what it is. The Hip-Hop Network strategic framework, we have worked with a group of orthopedic surgeons, physiotherapists, and other researchers around the world to develop this framework for the Hip-Hop Network. And we've settled on 4 main pillars for this network, being community, research, professional development, and growth and outreach. And all of these pillars will work together and have dedicated people from around the world that are involved and paying attention to each specific pillar as we grow. And within the auspices of the Hip-Hop Registry, I mentioned this earlier, is we hope to develop, and we're in the process of developing, a Hip-Hop Rare Conditions Registry. So we've talked a lot about ADH, about SLIP, about the hip and cerebral palsy. We also contribute to the International Perthes Study Group. But there are a number of other hip conditions that are far less common or far less talked about that really require global effort and global collaboration to be able to properly look at some of these conditions. And these are just a list of some of them here that we hope to build a registry around, and we are in that process right now. And so we are definitely actively seeking collaborators with interest on any one of these conditions or a few of these conditions to be joining in this effort. And hopefully we can start solving some of these problems in the rare conditions. So to talk about some of our IHDR collaborations, particularly with the centers in India, we've had 5 Indian centers that have been contributing to IHDR since 2016, 2017. And they have been absolutely excellent contributors and members of the group. They are amongst the top centers for data input and patient follow-up. So really, they're really leading the way and showing everyone how fantastic these centers can be. And this has culminated actually in an awarded paper at POSICON 2021 that Alaric Aroojis was the senior mentor on for a fellow called Deepika. Deepika presented this at the conference, and they were one of the top 3 awarded papers in the session there. And they examined demographic and practice variability across the 5 different centers data that are in IHDR. And that paper is now being submitted to the IGO special issue on BDH. And so for future collaborations, just to leave you with this message that we would love to collaborate with you. We need you guys leading efforts and being engaged in these projects to become the success that they are. What might be required on your side is some infrastructure to enter data. So good online connection. We provide the access to the database and everything on our side. But you do need some infrastructure, either a fellow or a research assistant or a dedicated clinic process to enter this data. You also need to get Research Ethics Board approval at your institution, but above all, a willingness and enthusiasm to get involved. And finally, before I let Kishore take over for the discussion, I'd just like to acknowledge our funders. We have a number of funders, the Peterson Fund for Global Hip Health, I'm a Hippie Foundation, POSNA, the Canadian Orthopaedic Foundation, BC Children's Hospital Foundation, as well as Divi's Foundation for Gifted Children. And with that, I will let Kishore lead the discussion, and we'd love to have your input and discussion on these too. Thank you.
Great. Thank you so much, Emily. I think that was really a wonderful expose that you've given us about both the important aspects, how to write a research grant and how to get some funding, and also about the various collaborations that the team from Vancouver has set up so beautifully over the last many years. Kishore, would you like to say something, or should we ask a few questions?
Yeah, probably some opening remarks, Al. So, we started with a very, very small study, and the first grant that I got was for, less than $5,000. I think if I remember right, was $2,000. And the most recent grant we got was $450,000. So it really, you got to start small, and any opportunity you get, just so that you practice and you take the reviewers' comments really seriously and see if you can address that and reapply. It's like what Benjamin Joseph told me when I was writing my first manuscript in Manipal. When it got rejected, he said, look, if you believe in that, And if you want to publish, you have to keep at it. So there are some that I know that we've submitted to 5 journals before it finally gets accepted. And grants are no different. And it's always good to have somebody who is not so attached to that study review it, so that, you know, they can look at it from their own way of advising you as to, you know, what's the best way to address some of their concerns. And as Emily mentioned, it's also important to be really thinking about lay language in there, because sometimes the people that review the grant are not necessarily orthopedic surgeons. And depending on which granting agency that you're applying to, and you're competing with cardiology, oncologists, and others, which are, you know, let's face it, the challenge we have in orthopedics is nobody dies from orthopedic problems. And you're trying to improve somebody's quality of life. And, you know, a lot of people think of orthopedics as elective surgery, and I don't think it's elective, it's restorative surgery. You're restoring somebody's function, you're optimizing somebody's function. So it's really important when you are writing that you bring in the significance and the burden of this issue, because that's what people need to be drawn to when they look at them, right? And before you get a grant, you need to show a track record that you're able to collaborate and you're able to work together. And those can happen in small steps, right? And I would humbly say, even though I'm not sure if Rujuta and Al have applied for a big grant, but they're well positioned because they have global collaborations. They've shown that they published a lot of papers with those in India, but around the world. And so Wadia is well poised if they apply for a grant, that there is enough track record now that they have infrastructure, they have a research coordinator. So those are the elements that you want to work on, depending on what you take on. And not every grant needs to be a multi-center. There are things that you can do in your own institution with your own time. And that's absolutely fine. And I think the other group that does really well in India is, I mean, we all know, is Ganga Hospital. And I think the infrastructure that Dr. Rajshekharan built and done, they're really good at leveraging what's out there. The last one that Emily mentioned, you know, Divi's Foundation for Gifted Children. I have a conflict because I'm related to the family, but even otherwise, I can tell you there are lots of now corporates in India that want to support, you know, their efforts in the medical field. And there is a lot of funding through corporate social responsibility to CSR, and medical research is one of them. So if you have grateful patients that are from corporates, and if you are doing good quality research work, because the pure government funding agencies, the funding rate is coming down as more and more people realize, you know, they can apply. Say, for example, in DRDO, Department of Research and Development in India, or ICMR, they all have grants, but they're really small, getting smaller because there's a lot of people that are competing. But you can apply with these corporates as long as you show them that you're making a difference and your research and your contributions are going to help change some of the codes for patients. You know, they will partner with you, they'll help you. So do look out for those. And sometimes it's difficult to have that conversation if they happen to be your own patients. But then what you want to do is, if they ask you, how can I help, rather than saying, no, don't bother, is get your colleague who is not involved in the treatment, lead those discussions. Because then if they're active patients of yours, that conflict is not there. Right. So, or sometimes your colleagues may put you in touch with somebody else. But I think that's something I would say in India we haven't explored a lot, is partnering with private foundations that might be interested in supporting medical research. And setting up multi-center collaborations, you really have to ask, what is the end goal that you're trying to achieve? And I can tell you, I can speak for myself and Emily, it's not about authorship. If ever you're doing a study and you think it's all about, you know, where am I going to be in the authorship, and you're trying to do a multi-center study, then it's waste of time. It's a lot easier for Emily and myself to just sit by the side of her desk and do research that can be done just out of BC Children's Hospital. But then we know that we're not going to be making an impact, because if you don't have large enough numbers, if you're not collaborating with areas where the help is most needed or the research is most helpful, then I can retire and say I'm the world's DDH expert, but my research is relevant to less than 10% of the world. As Emily talked about, when we first started, we were so proud. We were getting data coming from Harvard. We're getting data coming from Stanford, CHOP, which is one of the top children's hospitals in Philadelphia, Sick Kids Toronto, and one center in Australia, one in UK. And that makes it English-speaking colonial. It doesn't make it global. It doesn't make it international. As you've seen, between India and China, there is, more than a third of the children that are there. And if you look at late presenting DDH, and that's a lot of it now in our registries is from China and India. So if we're truly in the business of improving care for development dysplasia of the hip, very quickly, Emily and myself realized really the people that we need to have on our registries are not just Harvards and Stanfords, but we need to have the Wadia Hospital. We need to have the Bird Hospital in Tirupati, Manipal, and others. So, and that led to one leads to another. So you might think that's pure research, but even before we published any papers just with Indian data, we managed to partner with POSI, with, under Al's leadership, try to come up with guidelines, and now work on knowledge translation and other efforts. So one leads to another. So your collaborations just are not that for that one particular study, and it leads to other educational efforts and other research efforts, quality improvement efforts. And more than anything, as Rujuta said, gives us opportunities to move and shake at the sidelines of the meetings. And I've learned some karaoke singing. So I'm not good at Hindi songs, but had a great time at my last POSI meeting. So I think it just makes the world stronger, brings us together. And when you start thinking beyond your institutions, there's lots of kinks when you start to work with other institutions with data sharing agreements and institution policies. Ethics might be different at different institutions, but they can all be navigated. And what's really important is time. And all of us, it's at the expense of your clinical time. But trust me, it's worth it, because you either have a choice of seeing those 4 patients, or you have a choice of improving care for 40, 400, 400,000, 4 million, 4 crores, whatever you think about children's lives ultimately, if you are able to improve the process. So at some stage in your career, you need to ask yourself, are you going to be a machine that's just going to keep seeing patients? Or are you going to get involved where you're going to really assess the care that you're providing and the ways in which you can improve? And it's heartening to see how far India has come along. And congratulations to IOA. And we have published now 5 or 6 papers. And I see a lot of Canadians and a lot from US, UK now, trying to publish papers in Indian Orthopaedic Association Journal. I know Al and Rujuta are leading now they've recently read one symposium, and IOA, they're now leading another one. So it's great to see how nicely and how rapidly India is taking up looking at, scientific way to improve our care, not just providing care, but really looking at other ways. So thank you for this opportunity. I'm happy to take any questions, both from myself and Emily.
Great. Thanks, Kishore. You have really shared some wonderful tips there. I think one question I really want to ask you, because, one thing that's lacking in India is that scientific rigor that is so embedded in the West. And I remember when all of us went on our fellowships, the first thing we realized is how well research is conducted abroad. And there's no dearth of numbers, there's no dearth of, amazing cases that we have in India, but we just don't have that scientific rigor to follow up cases, to study our own results. Now, you're a person who's worked both in India and then gone abroad. You worked in Australia, you worked in Canada. How do you suggest that, people who are interested in doing good quality research, not just, publishing retrospective studies, because that's something that we all tend to do. We work in silos. Each institution just looks at a few cases, publishes a short follow-up, but we really don't have that body of research or that interest in prospective randomized studies at times, What would you suggest? How do you go about building a research team? Because I know that's one thing that you have done very, very successfully in BC Children's in Vancouver, and now as the head of the UBC. For people who are listening to this webinar, those who will come in on YouTube later on, how do you go about building a research team? Because, a single surgeon by himself or herself obviously cannot do all this sort of research. So what are your tips and tricks for that?
Yeah, I think number one thing is obviously your time, which is very valuable that you have to invest. And I know, having worked in India, all of you work from 8 a.m. to 9 p.m. or 10 p.m., 11 p.m. So your time is very limited. So within that, if you are willing and hoping to invest your time, very quickly you have to get to a place where you shouldn't be doing something that others can do. So that is having a non-medical person, maybe somebody who works in your institution that is a clerk or someone non-medical but understands science, be a part of doing all of the paperwork that's required, right? Submitting, if you have ethics board, following that up, standing outside your clinic room and to recruit a patient, getting them to sign, filing those consent forms away, merely putting the data in. I do know a lot of you do yourself. Al, you do a lot of that work yourself. So first thing to do is to protect yourself from doing that, getting people, help that you can probably pay a lot less to do that. And, that could be that you could probably see 2 extra patients to pay for that whole day of that person's time, right? It works out to the same. So number one thing is to really look at what kind of support you can build. And I can tell you, if I had to do all of this, there's no way I would have been able to do it. So over the years, we had research assistant, research coordinators, research managers. And now, then when you get to a certain stage, you need to build partners, right? So Emily truly is a partner now in this research. And she's a PhD scientist, so she's a real doctor. And she's a non-surgeon, so she's not interested in going to the operating room and seeing blood every day, but she's interested in, improving outcomes. So when you get to a stage looking for those opportunities for career researchers, I mean, you have several in India that have done science degrees, that have done MSCs and PhDs that are looking for opportunities to collaborate. So if they get inspired that they can partner with you and trying to improve care, and it will work, it'll happen. Some corporates now are looking at this, like in US, Mayo Clinic and others. I can give you an example from Apollo, for example. Those of you that work in big corporates, it's one of the things you want to negotiate when you join the hospital and starting to work, is that they give some infrastructure for you to be able to do that. And the last one is there are a lot of web-based platforms, and some we can share if you're interested in sort of following up your own patients, that we can share some of what we built that you're able to contribute to your own patients. And I know of a ENT surgeon in India who follows his own patients, built a simple database with a click of a button. He's able to pull up and analyze and look at them. And my cousin, who's an oncologist from Chennai Apollo, his name is Dr. Ramesh Namagedda, and he's a private practicing oncology surgeon, but built the largest oncology database there is in India called OncoConnect. And they have 500,000 cancer patients in their database. And very soon they will become one of the largest oncology databases in India and around the world. Sorry, around the world, not India. They already are the largest. They have, right from Tata Memorial to, you can name it, all of the major cancer institutes contribute data to that. Adayar, or whether it is the cancer hospital in Hyderabad or Chennai, or they're all contributing data to that. So same way, I think IOA should look at a program where you build a database and have surgeons contribute those that want to. And then gradually you can, change the pendulum. So if there are 100 surgeons that are contributing, if 10 of them get together and say, look, we want to pull our data, we want to combine and want to look at it, and gradually you will. And the way to do that would be, partner with industry. There's a lot of industry-led databases that are coming out right now. But, IOA or POSI can partner with them to make them available to all of your members, right? So AOS is doing that now, and they have a big registry program, which they actually support and lead, right? And so, those are some of my thoughts on how do you do that. But I think first you have to donate your own time. There is no substitute for that. And you have to be very rigid about that, right? It's like how some of you now, it's heartening to see. I know it's for some of you, I guess, there is still no Sunday, right? I mean, there is just a 365-day work. That's what I'm used to when I was growing up. It's heartening to see there are some of you now that put boundaries and that go, well, look, and Sunday at 12, I come back and I've got my family time. So same way, you have to start protecting yourself to be doing this work if you're interested. And I can tell you it is very rewarding when you look at your own results, you combine with others, you learn from it, and you actually see that your infection rate is coming down, your success rate with, say, for example, in our own realm, that you have more hip dislocations that you're treating, but you're actually treating them well. You have less issues afterwards. And over a period of time, combined, if we are actually seeing the mean age is coming down in India, even if you brought the mean age of late presenting DDH from, say, mean age of 5 years to, say, 3 years, that's a significant improvement in care. And so it's what I talk about is how do you build that passion that you have in you and protect it and know that that actually is going to bring happiness to you. And that's what it does for me. It's very easy for me to do the same amount of time I do in research. I could be doing other things that generate more resources or more income for me. I have tried that once in a while. We have these things called medical legals and others that you can do, and you can. I feel tired at the end of it, but I don't feel tired at the end of these meetings that I'm involved in, teaching or training or research. So it's really looking at what drives you. And then if that's a passion of yours, and then keep on exploring that.
So there's a question coming in on the YouTube, which is a simultaneous relay that's going on now. For Emily, students want to know if it is, how can they get involved with this, and if it is possible for them to write up a grant, or do they need to be under a qualified researcher, or do they have to be with a parent unit?
Yeah, that's a great question. And definitely for depending on where the grant call is coming from, most grants do require, say, a primary or principal investigator. And so students, but there are a number of, say, like student scholarship type grants that take similar that they can write, but they do need to seek out a supervisor that they can work under for sure. It's difficult for sort of standalone students to write and be allowed to hold a grant without that supervisor. But depending on what they're looking for, there's definitely, as Kishore was mentioning too, there's no shortage of surgeons that might be looking for students to come in and do some research work. And if the student is willing to put in the effort and sort of take lead on writing the research grant, if they partner with that PI, there's no telling where they can take it. So.
Dr. Rajagopalan sir, Sandeep? Any comments from Dr. Rajagopalan sir and Sandeep?
I have one, little different from what Dr. Kishore said and Dr. Emily said, I just want to ask them whether one of the factors, as you said, we have a problem in initiating, like, people getting interested in, people able to devote time and people being motivated. So do you think a separate, like you have it in Canada, I think that a faculty here has to do the treatment, surgery, everything. Suppose you have a separate faculty for only research. Will that help? I mean,
I can probably take that question, Dr. Rajagopalan. Yes. A surgeon that purely does research, I mean, they can turn at some point to be doing that. There are some around the world where they feel their impact is a lot better just doing research than surgery. But unfortunately, what happens is they get a tag of a podium surgeon. And especially if you're talking about surgical techniques and how to do them, and you have never done that yourself, and people start to question, oh, I'm not so sure. He was probably never in the procedure. So best would be to partner with, like how we have here, Emily. She doesn't operate, but I can tell you she knows everything about fractures, classifications, how to treat, because she actually attends our rounds. So we have a Monday and Thursday rounds, and Emily attends, and Emily hears our controversies, discussions, and whatever. But if people are drawn to it, you can. I mean, it's not uncommon for us to see sometimes plastic surgeons turn into cosmetologists, and they do very little surgery, but they do a lot of other small interventions. Same way, if there are surgeons that can do that, that would be great. I think one opportunity we have in India truly is, to some degree now I see, especially in the pediatric orthopedic world, and they're doing that well in India, is all of your PG projects, right? Every single orthopedic surgeon, if you have 5,000 of them graduating every year around India, I'm not sure the numbers, maybe 1,000 orthopedic surgeons every year. And if those 1,000 all have to do a thesis, I remember me doing a thesis. And my thesis actually went somewhere, it got published, and it added a little bit to the literature. And I remember more than 3/4 of them were topics that were just there so that they meet the requirement, versus topic that actually contributes. So if the examiners, the PG examiners and the professors in India all take with a lens that every single, because those PGs are putting those effort for those 3 years, they're working really hard to address that. And the second way to do that would be, think of a logical way of extending that. So imagine you have a study that is going to take 10 years, and you have 3 PGs, each sort of finishing at a time, writing up whatever they've done, and the school's recognizing the value of that prospective collection. Then you will change it. So that can be changed by discussions at IOA PG training committee with the heads of the departments in India, universities, to say the way that we can collect the prospective data is logically design every single PG project as a 10-year or 15-year study. And with one PG finishes, you get them to write up the results where they're at. And I love that to be, some might be logical conclusions and some might be ongoing. But as long as they've done a great job of collecting that data, and imagine what kind of data will come out of India, right? So we don't use the same cell phone. I change mine every 3 years. But if you ask me, a PG training or PG thesis, how it's done, is the same format as my mentor, Bhaskaran, wrote in 1977. And I was actually given the same topic in 1994. We improved that, but I can tell you, if you put his thesis and mine, they look very different from style to whatever, except the paper might be a better quality and the binding might be a little different. But other than that, the format was exactly the same. So the greatest opportunity, if you ask me, in India is everybody must do a thesis. That's not the case in Canada. I mean, they're encouraged to do research, but there is no structured way of every PG or every postgraduate trainee has to have a thesis. And that's an incredible opportunity in India. And you just have to shift your thinking from a standalone project to prospective studies Because the reason you have a standalone retrospective project for most thesis is you want them done, right? But imagine if you break it down, one person thesis actually setting up, designing the study and getting all the ethics approval. That itself is great, like, because they have contributed immensely to that project. The next one, you pick a logical next endpoint at the end of 3 years, and then the one following that and one following that. You will have incredible data coming out of India.
There's another question from Dr. Jeshwant N. So what is the procedure to get access to registries? Is it possible individually or through institutes only?
Yeah, so that's a good question. So typically, if you want to do individually, then you need to still figure out ethics. But one thing with any countries is this data is a personalized data of patients. So people want to make sure, A, it's anonymized and it's protected. So for us, it's very hard to work with individual hospitals if we are the sponsoring agency. Say from here, if somebody wants to join our DDH registry, for individual surgeons, it's going to become very, very difficult. If your institution becomes easy. But that being said, we could help if somebody wants to collect their own data. It's not difficult to set one up for them. And right up front, we say they own their own data. They can only see their own data, and they can then probably combine with others when it's required. So that can be done. And some of these, I mean, we can talk offline, Rujuta, but say if it's pediatric orthopedics, we can help POSI develop that. If there are 5 conditions where there are individual surgeons, they want to do a surgeon improvement program where they collect their own data, they get to see their own. It's not difficult to build that. And you can build dashboards, you can build others where they're able to. And then when they're ready to combine with others, they can. And so it depends on, how you're going to be setting that up and who is going to lead it.
Thanks, Kishore. I think you've given us some really good tips there. I think your suggestion about the thesis is really amazing and something that we should be looking into, This thing of how you say you hand over from one to the other. So one just works on the methodology of a study and someone else can then take it to fruition. Unfortunately, thesis in our country is taken just as something that has to be done and has to be completed. And very often I find in most places, the guys themselves have got no interest in the thesis. So therefore, the student just sort of copies a thesis from somewhere else and just changes a few things here and there. And what could have been a really powerful tool for research in our country is really very underutilized. And I think Dr. Rajagopalan is here as a very senior member of IOA. If he can lead a project of this sort, to make thesis something which is really worthwhile to advance research in our country, rather than being something that just has to be completed for the heck of it and really doesn't contribute much at all. Someone just copy-paste someone else's results and methods and everything down. That doesn't serve much purpose at all. So I think your suggestion is really great in that. I think we have done some of that in Wadia where, since we have been part of the IHDR and we know that it's a prospective registry, every fellow is involved with the data collection and entering the data and being involved in the process. And when they see the surgery being done and then enter into the database and then seeing the follow-up over time, and even if they can't finish it in their term of their 6 months or 1 year they work with us, whenever we go back and write up something, each of them will be acknowledged onto that study as an author, as a co-author. So that itself is a great stimulus, I think, that we have understood that fellows then seem to take interest in what they're doing then. So that's something I've really learned from you and from Emily. And thanks so much for sharing some of those pearls with us. If there are no other questions, Rujuta, is there anything else? Or for the delegates, anyone else?
From me, myself, that with some writing agencies offering help to write up your project, how does that stand in terms of both ethics and entering a registry? Is it still valid, or if they just take the data and write it up for you? Is that how does that figure in the scheme of things?
So you mean to say they write the manuscripts, they take your data and write it?
Yes. Yes.
Yeah, I mean there are those you're talking about, like contract research agencies that do the writing.
Content developers, yeah.
Yeah. So, that's totally fine as long as you still have your lens in guiding and interpreting, right? I mean, they're basically research assistants, coordinators, managers that are in one central area. And but they don't have your expertise. They don't have your knowledge that you have. And the way they may interpret the results when they write down might be different than yours. So they can substitute. I mean, they can write in a language and a format that is easy to sort of submit, but it's still not something where they can substitute for your expertise on the field.
So how do journalists view these kind of efforts? Do they accept these kind of collaborations?
Yeah, to be honest with you, if somebody is helping you write a manuscript, which we actually do, so we're not a contract research agency, but Emily helps orthopedic surgeons from China quite a bit when they're trying to write their manuscript. It's not our data, it's data from China. A lot of the time, we're not even authors on it. Not a lot of the time, till now, we're not even author on one of them. But she would help them with not write the manuscript, they write their first draft. She will edit it quite heavily and she will send it back to them. And that doesn't make that manuscript any weaker if you're advanced in the science. Same way, if somebody says, look, I'm not great at writing. For example, I can't write like Dr. Benjamin Joseph does or Alaric. So I surround myself with people that can write really well. And when Emily first started, that was the greatest strength for me. And she can write really well. And also she thinks scientifically. That's a rare thing that you can find. And she being a PhD scientist. So if there are people like you've got these ideas, but you're not gifted like Al in writing, and you want to take help from an agency. So you either pay your own research assistant, or for that project, you pay someone to write that for you. I see no problem with that. As long as you still are the brain behind, the science behind, and you're contributing to the interpretation, right? And not everybody's got Shakespeare English like Dr. Benjamin Joseph or Al. And those that are not gifted, it shouldn't put them away from scientific writing. So scientific writing is not are you proficient at Shakespeare English? And that is also another problem in India is people say, well, my language skills are not great, so I can't write. Well, partner with someone that has them, right? So and then that way you're able to take your ideas and convert them into scientific communications. Any thoughts on that, Emily?
Yeah, so I agree with everything you say, Kishore and Rujuta. I would just add to, if you're, say, employing a writing agency, and usually journals will require you just to disclose it, but it doesn't have any impact, it doesn't have any impact on the process ethically or anything, but just ethically, you just need to disclose it. That's what's happened. And yes, definitely, seeking sort of non-agency, but other scientists, other writers' advice as you're going through or having a look through your manuscript can also be a good stand-in for that. As Kishore mentioned, it's generally I'm more than happy to look through and edit drafts, existing drafts of manuscripts to see where we might be able to improve the language and things like that. And don't need authorship in that way, but just, acknowledge the person that did that. And I think it's fine.
Okay. Thanks, Emily. Thanks, Kishore. We are also happy to have some of our ex-fellows from Wadia on this group. And I can see Avi is here, Jaideep and Chintan, and many of them, even after they've left Wadia, have still collaborated with us on various articles and publications. So it does not mean that once you've left an institution, you should stop your research work or your collaboration with your previous mentors. I think it's great that many of them have continued their collaboration with us. And, publications and research takes time and effort. And in the time that you work in a certain institution, you may not always get to complete that project in entirety. But maintaining that collaboration, I think, is really helpful, because even down the line, you can continue to publish. I also see we have Sorush Baghdadi here. He is a great friend, and he is from the Children's Hospital of Philadelphia. He's written a lot of wonderful articles in pediatric orthopedics. Sorush, it'll be great. I know you joined in a bit late, but if you could share some of the tips from your side as well, how do you go about writing some good articles? You've got some great work that you have published so far. More recently, you worked with us on that special issue in clubfoot, and you wrote up a wonderful article on outcome measures in clubfoot, which was really a hard one to write. So if you could share some of it with our younger colleagues who are on this webinar. Thanks.
Hello, everyone. I wasn't going to participate, actually. I was just listening. But I think, teaming up with the big people in the business is the best thing that can happen to research projects. So I had someone like Dave Spiegel on this paper, and you, of course. Also, I think that's the biggest thing that can help you with, with authoring a paper and doing research projects. I'm sorry, I was a bit late, so I'm not on board on all of what you're talking about.
Sure, thanks. No problem. Thank you for those comments. That's excellent, absolutely. Any other questions from anyone on the panel? Any of the delegates?
No, I think.
Yeah, so we've reached the end of the time, and we really enjoyed this little webinar that we've had. Emily, Kishore, we've been looking forward to this for many months now. And ever since we got the grant, our first thought was that we definitely must have a talk from both of you all. Rujuta and I both have benefited immensely from our collaborations with you, Kishore, Emily, more recently with Aroojis and other people from his team at CHOP. And we really value these collaborations that we've developed with so many friends from around the world. So thank you once again for sharing your experience and expertise with us. And a few words from Sandeep Wadia, a small vote of thanks from him. So over to you, Sandeep.
You're mute. Sandeep, you're mute.
Thank you, Alaric. It was a wonderful 1 hour that we spent, thanks to Kishore and Emily. And you have touched upon two extremely important topics in the research. One is regarding application for research grant. And the second is regarding the need for multi-center collaboration in order to come out with high quality studies. And both of these things have been, lacking in India, I must say. But I think you have just, set out a framework how to go about it. And this video is also going to be available on YouTube. So I would also encourage our, faculty members from other institutes as well as students to, log into our YouTube channel and go through this video. It was a wonderful 1 hour again. Thanks to all the IOA office bearers, Dr. Shivashankar, Dr. Navin Thakkar, Dr. Rajagopalan sir, and myself on behalf of Wadia Hospital. Enjoy a great weekend and stay safe. Thanks.
And we have to thank the IOA TV team.
Ashok and team, they have been a wonderful
post-streaming. Yeah.
Absolutely. Thank you so much.
So thank you, Dr. Rajagopalan sir, and wish all of you a very, very safe
Thank you.
Thanks.
Thank you so much.
Bye.
Thank you. Bye-bye.
Thank you. Thank you very much, all.
Thank you, everyone, for tuning in, all the participants.
Thank you. Bye-bye.
Thank you.
Thank you.
Thank you.